Hello, my name is Miriam Han, and I'm an undergraduate researcher at BioPT Lab at McGill under the supervision of Dr. Stephanie Blaine-Morris and PhD candidate Charlotte Mashk. Thank you for this opportunity to share my passion for this research with fellow scientists. After patients experience a traumatic brain injury, they're often diagnosed with disorder of consciousness. These disorders are characterized by impaired wakefulness and awareness, and specifically can be divided into three categories, depending on their level of self-awareness and environmental awareness. It is difficult to accurately assess levels of consciousness and predict the prognosis of patients with DOC because their behavioral responses are often inconsistent and ambiguous. Currently, there are inevitably high rates of inaccuracy in the diagnosis and prediction of recovery, which hinder physicians from providing the best treatment, setting realistic goals of recovery, and making ethical decisions regarding the patient. This leads to our first main takeaway, which is the importance in establishing a non-task dependent measure that does not require behavioral responsiveness to assess covert consciousness in DOC patients and their potential to recover consciousness. I would like to now move on to the second takeaway, which is that reconfiguration between anesthetized and baseline state can be used to distinguish the patient's potential for recovery of consciousness using general anesthetics such as isoflurane and propofol. In this case study, 5 minutes of resting state EEG data was recorded from one healthy participant and two brain injured patients during the baseline and anesthetized states. The EEG data were analyzed to characterize each state in alpha and theta frequencies. The first feature of interest was the topographic location of the hub during the sedation and baseline states of subjects. And the second was the directionality of functional connectivity measured in DPLI. So the healthy participants showed that during the anesthesia, there was an interiorization of alpha hub, and in the directionality of the functional connectivity, there was decrease and reconfiguration in the change of the direction. In comparison to the healthy brain, the recovered brain patient had the similar changes observed during baseline, while the unrecovered showed static brain. If we move on to directionality of functional connectivity, again, the recovered patient showed a reconfiguration between these two states, while the unrecovered patient did not. This study represents a method of assessment that is robust, generalizable, and easily translatable in routine clinical practice. It holds great potential in developing techniques to uncover reconfiguration patterns in brain injured and DOC patients to improve accuracy and confidence in physicians' assessment.